the definition of erectile dysfunction is the difficulty in achieving and maintaining an erection sufficient for intercourse. And so most men, unfortunately, if you live long enough, will experience erectile dysfunction. And the good news is that there are plenty of opportunities to help. There's a lot of medicines and techniques and devices and surgeries that can aid in achieving your erections and getting that back. We know that erectile dysfunction not only affects the man, but it affects your partner. And so we're actually treating two people at the same time when we treat erectile dysfunction. So my message is know that you're not alone, and know that there is help, and you just have to seek it. And so one of the easiest things to do for erectile dysfunction is just to check your lab work, just to see if your testosterone is low. Many times when our testosterones are low, we don't respond well to stimuli. And so the first and foremost thing that I would recommend is to check your testosterone, because if you have low T, that can be easily treated. The second thing is we can treat ED with medications. Everyone's heard of Viagra and Cialis and Levitra, and there's a few others. And those drugs are meant to promote blood flow to the pelvis, and so you have to be stimulated in order for them to work. But in moderate cases, just having the pill will work. Sometimes you have to be treated first with your low testosterone to get that up, and oftentimes it's a synergy between the two. The combination of testosterone therapy and the pills will help. But for men whose erections are more severe, or erectile dysfunction is more severe, there are pumps, vacuum pumps, that can be used. They are a little mechanical, but they work well if you know how to use them. There are injections, direct injections that one can do directly into the corporal bodies. They will give you an erection within minutes, and the erections can last anywhere from half an hour to 2 hours. There are suppositories that can be inserted into the urethra, and there's actually surgery that can put a device within the penis to achieve erections. And so I always say that there's always a way. Where there's a will, there's a way. And if you're serious and you want to do what you can to be healthy and to be whole, to restore that part of your life, we can certainly help you.